Did you know that when it comes to quitting alcohol, low-level interventions can be helpful? Research shows that low-intensity interventions can be highly effective in reducing the risk of alcohol-related disease by getting people to drink more moderately or stop drinking completely. It is interesting to note that some people know when they're drinking too much. They feel it in their bodies or notice that alcohol is starting to affect their work and personal lives. Having that level of awareness is very fortunate. Here are 6 approaches that can help identify or stop drinking problems at an early stage. Education and awareness. The journey of healing begins with understanding that there is a problem. There are many ways to become educated, including books, articles, and documentaries on the topic. One of the most historically popular ways people have gotten help is through Alcoholics Anonymous. Being in the room with others sharing stories about how drinking impacted their lives can help people identify where they are on the spectrum between social drinking and alcohol abuse. It is also a place to find support and guidance on the next steps. Research has shown that mindfulness helps with anxiety, depression, and stress, and it has been successful as a lower level intervention in addiction recovery. It is low or no cost and can be done without a therapist. So learning these techniques, widely available in workshops, manuals, and books, can be useful to anyone trying to quit or stop drinking. 2 important aspects of mindfulness are learning to stay present in the moment and developing a new skill set for dealing with unpleasant feelings. Rather than trying to soothe uncomfortable feelings with alcohol, mindfulness encourages the use of specific techniques such as breathing, visualization, and meditation. Outside of therapy or drug rehab settings, this is often a single session intervention offered by primary care physicians, nurse practitioners, and emergency service professionals. People who are seen in an emergency room after a motor vehicle accident and are evaluated for alcohol use, for example, may be helped by brief interviewing combined with motivational interviewing. Research shows that it has significant mitigation in people who binge drink. This approach includes several steps, including empathetic listening to a client's experience, paying attention to the way they communicate, working on client resistance, negotiating a new approach to the problem, and consolidating their commitment to making a change. Research shows this approach can reduce alcohol use when offered in medical settings. Medical schools are now training doctors in emergency medicine and other specialties on how to intervene by screening for alcohol problems, offering a brief intervention as well as brief treatment and then giving a referral to specialty treatment. Did you know that participating in mandated alcohol diversion programs has been shown to significantly reduce the risk of driving drunk again? Many states and cities have implemented this approach, especially with first-time offenders, in an attempt to curb further alcohol use. They often require people to attend a class in which alcohol problems, poisoning, and related accidents and deaths are discussed, and slides of accidents are shown to reduce participants from driving under the influence. There is usually a fine or payment involved, and participants write a reflective paper on what they learned. Community service is also a component. Diversion programs have proven effective with many populations, from college students to health professionals to prison inmates. Taking it up as a challenge. Some people are drawn to the idea of voluntarily abstaining from alcohol for a certain amount of time. The idea is that if you can get people to stop drinking for a set amount of time, it may help them minimize drinking and improve their health in the long term. If they cannot stop drinking for a short period of time, the challenge encourages people to take an honest look at their alcohol use and get help. One of the most popular challenges is the Dry January challenge, which is gaining popularity because participants were given some tests that showed they consumed fewer drinks months later. That is, participants did not drink or drank less in the month of January in the beginning of a year, and later on it improved their drinking habit. That is, they drank less. Keep in mind that alcohol craving gets worse over time, so additional support may be needed, such as support group meetings or alcoholism treatment. Some people wake up one day and know they have had enough, but more commonly it is an accident, illness, job loss, divorce, or arrest that acts as an intervention. When alcohol use is more severe, several approaches may be needed to break through the person's denial. A formal intervention by a trained specialist can sometimes help families overcome this hurdle. Thank you so much for watching. If you liked the video, please like, share, and subscribe to my channel.